My name is John Raimondo. I'm the president and CEO of Pulmonair. Well, I grew up in Corpus Christi, Texas, and went on to Texas A&M, and I graduated with a degree in psychology, and then I got another bachelor's degree in biology. Pulmonair is distributing intrapulmonary percussive ventilation. We call it IPV for short. And what IPV can do is it opens up your airways, which is really important. With chronic lung disease, your airways close and they have a hard time opening back up. Number two, we exchange gas for you. And that's typically why a COPD patient feels tired and sluggish and they get out of breath, is because their CO2 levels in their blood is very high. So we wash that CO2 out, okay? So we try to get what we call back to what we call homeostasis. The other part about what we do is at the same time, we're bringing up secretions from the lobes of the lung up so the patient can either cough them up. Typical patients that are at home are using probably a bronchodilator, and it's a quick treatment. It's a puffer, we call them puffers. They take a treatment, lasts 4, 6, 8 hours depending on the medication, and that gets them going. I mean, that opens up their airways, it allows them to breathe, it keeps them from developing something called atelectasis. As these medications start to lose their effectiveness, the patients will maybe have an episode of the flu with an onset secondary complication of pneumonia. They get hospitalized. Some of the facilities are treating, in the San Antonio area, are treating these patients with IPV already, with our hospital version. Patients that'll benefit from IPV can be as simple as someone that has pneumonia, to cystic fibrosis, pulmonary fibrosis, COPD. The technology has to get put on the patient, and the patients need to know about it, number one. And that's been the barrier to patients, is that we've utilized this technology and the patients they're asleep. Typically they're not awake when they're getting treated by IPV, so they don't know, they're in the hospital, what helped them the most, right? Or what really worked. And so by going into the home and, and sharing this with people is really my main goal, is that they have another option, they have another opportunity to maybe extend their life, improve the quality of their life.